Hey, we're on. Okay. We're having a little trouble getting on the air here this morning. So today we're going to talk about an election day related condition. It's election day 2016. There's a little bit of anxiety out there. We're going to talk about chronic urinary tract infections and overactive bladders. And is anxiety a contributing factor? I'm Dr. Martin Rutherford. I am a certified functional medicine practitioner. I am a chiropractor.
Dr. Randall Gates, board certified chiropractic neurologist, as well as being a chiropractor.
Okay. So the way this subject came to be, and the way many of our subjects come to be, is we do intakes. We actually interview patients before we are able to determine whether they would be a good candidate for our program. Would their type of condition respond? And a lot of the main issues that we treat are fibromyalgia, peripheral neuropathy, chronic fatigue, dizziness, vertigo, migraines, and on, restless leg syndrome. And in treating those, we started to understand that there were certain elements that were consistent among them. And those elements we talk about all the time. We talk about thyroid, we talk about gut, we talk about autoimmunities, we talk about stress hormones. But in these folks coming in, they don't just come in with fibromyalgia, or they don't just come in chronic fatigue, or they don't just come in with migraines, or they might come in for anxiety, as a matter of fact. And then in taking the history, we'll find out that they have a number of other conditions. They haven't really related at all to the same causes that are causing, for example, their migraines or their fibromyalgia. And one of the conditions that women are generally surprised to find are totally related to the same chemical pathways, the same vicious cycles, the same neurological pathways that are causing their fibromyalgia is urinary tract infections. They're surprised to find that that's not a separate entity from what they're suffering. And in a fibromyalgia patient, their hair is going to be falling out. Maybe they put on weight. Maybe they can't put on weight. They got heart palpitations. They have bad gut. Usually, they have an autoimmune problem. Usually, it's Hashimoto's, but they might have celiac. They might have antibodies against their cerebellum and have dizziness and vertigo and balance. But a substantial portion of them have chronic urinary tract infections, which very few, if any, that I've interviewed seem to connect the two. So we're going to talk about anxiety, and we're going to probably talk a little bit about what anxiety is, and then we're going to go into how that results a vast majority of the time in these chronic urinary tract infections and cause your bladder to be overactive. And I think it's quite a timely topic, because how common is this condition in our practice?
It's incredibly common.
Yeah. It's like amazingly common. There's certain things I've been stunned at in becoming involved in this chronic pain issue, and just certain things that have come out. The one thing that I was very, very surprised with, even before you got here and interviewing fibromyalgia patients, was the amount of physical and verbal and sexual abuse that was out there. I mean, I'm still stunned, frankly, in the interviews that we do, and how often that is a problem. And this kind of goes along with that. The anxiety comes from similar mechanisms, but anxiety, depression, chronic urinary tract infections. I mean, most people don't come in for those, but but a substantial portion of our patients come in with those.
Right, and I think the large percentage of patients coming in with those are unaware of there being any relationship to what we're talking about on the functional side. Is because in the urology world, it's basically you have chronic urinary tract infections. We need to make sure that they don't become fulminant and spread to the rest of the body, and you become septic. So we need antibiotic use, which frequently becomes preventative. So maybe they say, okay, before you have coitus, or which is sexual intercourse, you're going to take this antibiotic, or you're going to take it afterwards for 3 days. Or if you feel that something's going on, let me know, or take this antibiotic. And that's really the standard management strategy that's discussed throughout the literature and medical textbooks, so on and so forth. And so I think that's really patients' frame of reference for the condition. A lot of people talk about, okay, well, let's use cranberry for those who are more alternatively minded, or D-mannose. There is discussion now in the literature regarding probiotics, because in essence, what we find is that the flora of the GI tract has tremendous importance for the flora of other areas of the body, including, but not limited to, the urinary tract. And so those sorts of strategies are really what are being talked about. But there's not a lot of discussion about anxiety as it pertains to chronic urinary tract infections, which I was kind of shocked by this morning. I thought this was going to be an easy.
Dr. Gates is talking about, he researches these topics before we deliver them, and usually comes up with more research articles than we need to put online to present the fact that we're not making this stuff up.
So minding the research this morning, I was thinking, okay, well, this is going to be easy. And it wasn't easy.
Interesting.
Because there wasn't a lot of data connecting chronic urinary tract infections to things like depression, anxiety, stress, phenomena of that nature. There was some association that those of you who have chronic urinary tract infections have depression, and they were saying that you're depressed because of the chronic UTIs. But I thought that was an interesting connection. When you look at the physiology, though, and we're going to tie this into overactive bladder because they're pretty similar in some of their physiologic components. How do we urinate? When we want to urinate, you have to shut off a stress signal that's pretty dominant in your spinal cord going to the bladder so that you can get rid of all of the urine. What we've seen in our patient population is that when we correct their stress responses, and we deal with a patient population who has a very high prevalence of depression and anxiety, insomnia, history of abuse, post-traumatic stress disorder. So we find that a lot of these patients, and we're not saying this is completely representative of all the chronic UTI patients, but we wouldn't be surprised if it is to a certain degree. And that all of these patients who are in our clinic, as Dr. Rutherford said, they're under stress and they don't know it. And stress is a bad word probably for this discussion, because a lot of people say, well, I'm not stressed. I feel calm. I feel normal. But when we look at their physiologic signs, they have signs that they're in a chronic fight-flight response, and then many other components like they can't sleep, or they have PTSD about certain circumstances, or they have obsessive compulsive disorder. And so there are characteristics of fear to their personality and some of their traits, but they're not really aware of it. And so when we do our examination, we see signs of this activation of their fight-flight system, like they're always ready to run from the lion. What you then have to posit is that, okay, what is this doing to other areas of their organs and their organ systems? And being the urinary bladder, that bladder is going to be getting a lot of fight-flight signals. And when you're running from a lion, you're not thinking about urinating. So there's going to be a tendency to accumulate fluid in the bladder and not get rid of it, or maybe you get rid of it, but you don't get rid of all of it as well as you would like to. And so this is what we're hypothesizing based on our clinical experience.
I didn't realize we were hypothesizing. Usually the research is all over the stuff that we're doing. Just to add on to that, I mean, it's something that seems to cognite with patients when I'm having a hard time getting them to understand this is, and you hit on it, you said they don't feel like they're stressed. Okay, and technically you're not. This goes, technically your fight-flight mechanism is a good mechanism. It's a survival mechanism. It's a mechanism, however, that is only supposed to be engaged intermittently when there is danger. Unfortunately, I was reading an article this morning. I joked about it being election day today, but I was reading an article by psychologists this morning that are being overwhelmed by patients who have anxiety and depression and panic attacks because of the election and because so much fear has been put out there. You've talked about this for years as to how our frontal lobes are bad because we're just being continually hit with fear and fear and fear. So, but the point being that, so we're not supposed to be like that all the time. We're just supposed to be that short period of time. We're supposed to be in fight flight, and that's good. But when you're in fight flight, what your body does is it puts you in a position to fight or flee. So it literally sets off your adrenal glands. Your brain tells your adrenal glands to start flooding your system, not with just stress hormones, okay? We think adrenal glands are stress glands. Blood sugar, mineralocorticoids, glucocorticoids. In other words, it starts mobilizing sugar, it starts mobilizing minerals, it starts making your heart beat. So everything happens so that you can get blood supply and all of these other things to your arms, your legs, and your brain, and that's to make you fight or be able to fight or flee. And as Dr. Gates alluded to, when you're fighting or fleeing, you don't need to think about peeing. You actually don't need to think about pooping. You don't need to think about sex. So what the body does is shuts down your bladder, decreases blood supply to your intestines, so you're pooping, okay? It actually slows the intestines and shuts them down from moving. And then it takes all of the chemicals that make your sex hormones and takes them to make stress hormones. So it's kind of a cool thing, but it's only supposed to be there for a short period of time. And one of the things that we started to realize, and the functional neurologists were the guys who nailed this, was that we had to take this pattern, because it does a lot more than that. The stress hormones, they'll give you depression, they'll give you short-term memory loss, they'll give you brain fog, they'll affect your sinuses, your lungs, they'll affect a lot of things. So you need to shut them down as quickly as possible. And what these gentlemen and ladies figured out was we had to take that pattern and put it up against every chronic pain patient that walked in the door, because how many chronic pain patients have all of those symptoms? And so we just picked out the bladder to talk about today, because urinary tract infections are like epidemic in our office. I think it's a fair thing to say, and nobody comes in with it. So I don't know, maybe that was one of those asides where you're going to say you should shut up and let them talk. But I feel like that explanation seems to help patients a lot when we're trying to help them to understand what Dr. Gates is about to tell you about why this bladder, it's like the wrong target, okay? The bacterial infection is like the wrong target.
Yeah.
The target is
wrong long-term target.
It's the wrong long-term target, right? The short-term target is the bacterial infection. But for chronicity, it's the wrong target. For chronicity, the target is what Dr. Gates is going to talk about, which is this.
And that's what we were saying in terms of hypothesizing.
And that goes to his point of, you're not particularly, it's not that you're stressed, or for some reason, your brain is continually engaged in fight flight instead of just using it when it needs to be used and then shutting down.
And that's really it. So we're hypothesizing that is a primary driving factor of chronic UTIs.
So why are we hypothesizing?
Because we see it all the time.
We see it resolve.
And we see a lot of our patients improve, especially going through our protocol, and they need antibiotics less frequently when they go through our protocol, because they're not having this chronic activation of their sympathetic nervous system to the degree it was when they walked into our office. Now with overactive bladder, they've observed this to be exactly true. So in overactive bladder, probably more attention has been placed on this, just because they don't have a urinary tract infection. So their blood tests, their urinalyses are clean. So the urologist is left there scratching their head, okay, why is this person having to get up 3 or 4 times a night to urinate when they're not drinking excessively? And the reason is because of this association with the fight-flight response. There's a tremendous association with anxiety, basically, in overactive bladder. Same thing with depression to a lesser degree. Bottom line, though, is that the fight-flight response is innervating that bladder, basically shutting it off so that they don't completely void. They have a tendency to accumulate too much urine, and then they feel like they need to go all of a sudden. So they go and void, but incompletely.
And what is the neurology and the chemistry of anxiety that causes that?
That can be semi-complicated, but in essence, we have a whole broadcast on this. You can go back and go on powerhealthtalk.com, search depression, search anxiety. In a nutshell, for example, with anxiety, the fear center becomes activated to too great of a degree, and the frontal lobes stop modulating that fear center, as well as the memory area modulates that fear center. So the frontal lobes and the memory area become kind of weak for all intents and purposes. And then because of that, the fear center starts to escape, and it starts to dominate the brain with these fearful thoughts, which then have massive effects on our physiology, not only hormonally through the adrenal glands, but also through the autonomic nervous system, which is what we're talking about. Sympathetic nervous system, fight, flight, versus rest and digest responses are low.
So the point of that for me, for you, was that anxiety is actually, you could almost call it not a personality disorder. You could
Right,
call
it's classified as that, but
it's
people
classified
shouldn't
as
think
that.
that there's something wrong with their personality. There's
Right.
something wrong with your neurochemistry.
It's
really.
actually a neurochemical problem. That if the neurochemical problem is able to be gotten under control, the anxiety and the next level, which are panic attacks, tends to go away. And those same mechanisms are mechanisms that are caused in that entire picture that I painted before relative to the fight-flight syndrome.
Right, exactly. And with anxiety, then most of you are thinking, okay, well, do I need to take Xanax or do I need to take Prozac, which are the common medical interventions. But you'll see in our depression and anxiety broadcast that while those drugs do work, those are just examples. But drugs of the benzodiazepine class and SSRIs and whatever you want to say in terms of antidepressants, they do work. But psychiatrists are actually fielding a lot of the research as to why a lot of these drugs don't work long-term. And they don't work long-term for reasons that we went over in that other broadcast, including gut bacterial influences on the brain, hormones. So when people have if a guy has low testosterone or a female has low estrogen, that can be associated with depression. Autoimmune responses to the thyroid, that's critically associated with depression. Are your thyroid hormone levels correct? So on and so forth. Obesity is a major contributing factor. Cortisol levels. All these things we have to look at as damaging basically frontal lobe neurons as well as the memory area from the hippocampus, those neurons. So that's what has to adequately be assessed for a patient who has overactive bladder or a patient who has chronic urinary tract infections in our world for them to have a good long-term outcome. And also examining an individual's daily routine. This is something I'm finding clinically to be helpful too, because as we've talked about, when you look at the average American and their day-to-day activities, frequently people wake up late, then they don't have time for breakfast, but they have time to get a coffee, so they drink their coffee, which is an adrenal stimulant. It stimulates that fight-flight response. So you're awake and you're alert and you're oriented, and then they may or may not
$4.50 for that coffee to screw them up.
Right, exactly. And they may or may not eat lunch, and then if they do eat lunch, they eat too much, and then they get tired in the afternoon, so they have to drink more coffee. They rush home, they're late, they stay up way too late because they're wanting to zone out, and then they wake up late the next day. And on top of the fact that there are probably many other factors, but that's a common thread to a lot of people. And I know I have lived that life at one point, and it's very, very stressful, and you don't even realize it though. And as you would make fun of me, it's probably not the right verbiage, but when at times I would be doing a million things and Dr. Rutherford would ask me a question, I'd be like, I'm not stressed. He'd be like, you're stressed. I'd be like, I'm not stressed. I was stressed out of my mind. I just don't want to admit it because it's almost like a sign of weakness in our society to say, I'm stressed or I'm afraid or I'm anxious. A lot of people are really afraid to admit it. But these problems are so pervasive. 30% of the population has anxiety. 50% of the population has insomnia, which is traced to an overactive fear center most of the time.
Same thing is causing your chronic urinary tract infections a lot of time. Absent of pathology, absent of some pathology in your urinary tract, this is what's causing your chronic urinary tract infections a substantial portion of the time. And then they give you antibiotics. And the antibiotics for the short term, the antibiotics, yes, good, get rid of the infection. But the antibiotics also, Dr. Gates briefly mentioned probiotics are being investigated for urinary tract infections. Then what?
Well, then you're taking antibiotics chronically. They have implications. They basically imbalance your gut flora. So we have 100 trillion cells in your intestines. You have more cells there than you do in the rest of your body. And what we're finding is that these bacteria have huge importance. They make bacterial poop, if you want to think of it that way. They make chemicals that really influence a lot of our physiology. When the gut is imbalanced, you can watch all of our broadcasts. We talk about the gut and its influence in metabolic disease like diabetes, its influence in autoimmune disease like autoimmune thyroid disease, things like MS, rheumatoid arthritis. And so we all know that chronic antibiotic administration is not good, but for those of you who have chronic UTIs, your doctor has to give it to you, because if he doesn't, then he's committing malpractice, because potentially you could develop a kidney infection that spreads the rest of your body and you could die. So that's kind of the exquisite balance going on. You have to see what your urologist or your GP is faced with, or your OBGYN, in terms of having to give you these antibiotics. But look at these other factors we're talking about that could really be wreaking havoc on your physiology and perpetuating why you need to keep taking antibiotics. That's what we're saying.
Yeah, so the brain, you get stressed, you get anxiety, you get panic attacks, but let's just say you get stressed, you know how you get butterflies in your tummy. I know for myself, I was just saying to Dr. Gates beforehand, I've probably done over, I don't know, I've done hundreds and hundreds of talks, public talks. I've talked to people. I've talked to one person at a lecture. I've talked to 2,000 people and everything in between. And before any talk, I always have to go to the bathroom a lot more than I'm used to. And I don't feel nervous, but I do. So you have that subconscious nervousness or whatever it is that's causing that to go. And that's kind of that fight flight mechanism on a very low level. And that fight flight mechanism is actually the target to me for the chronic urinary tract infection patient who doesn't have some sort of pathological issue that's causing it. And then that fight flight mechanism also causes butterflies in your stomach. When it's there for more than it should be, that fight flight mechanism should be very brief, 5, 10, 15, 20 minutes, then it should go away. But it's when they're constantly, you get a bad gut because stress hormones flood your gut. And it's telling you not to poop, not to pee. And by the way, it's a big cause of lack of libido because it decreases your sex hormones. And so now you have that whole thing going. You get a chronic urinary tract infection because the urine's not clearing and it's there. They give you the antibiotic for that. Now that screws up your gut.
Exactly.
Which your brain just got done screwing up. Now your gut puts out all of the poop that you're talking about. One of the areas that the poop screws up is your brain.
The bacterial byproducts.
The bacterial byproducts will go up. And we have people, very simple, we have people get off of gluten, the hopefully less controversial gluten. And they go, oh, my brain fog got better. Oh, my short-term memory loss got better. It's because gluten, we just did a 5-minute segment on it before we did this. Gluten affects your brain way more than it affects your gut. So what are the true targets here for urinary tract infection? Brain is the true target. Gut is probably your secondary target for chronic urinary tract infections. Dr. Gates made a great point. For acute urinary tract infections, the bacterial antibiotic is obviously.
And everybody's going to talk to you about hygiene. I mean, your doctor's going to talk to you about hygiene. Your urologist, your OB/GYN, they're going to talk about, intercourse, things like that, washing pre and post. All that we are saying has probably been handled. But for those of you who are chronic, these are the mechanisms why you're probably not getting better.
Right.
So I think that pretty well covers it. And you can go to powerhealthtalk.com for the references attached to today's broadcast. If you have any other questions, search on powerhealthtalk.com regarding depression, anxiety, gut function. And I think that pretty well summarizes it. So if you have any topics that you'd like us to discuss, let us know. We can no longer field personal questions, but you can give us your topics that you're hoping for us to cover. So thanks for watching, and we'll see you next time.
See you next time.